mother tongue. So, yeah. And she's been working as a sign language interpreter for more than 5 years with government, national, and international agencies like UNICEF, G20, and CPDP. And also, she is a special educator. And about Pinky, she also has sign language, has a mother tongue. She grew up with that. She has worked as a sign language interpreter with ABP News, many government and international organizations as UN and UNDP, and many more. So thanks for their presence as interpreters today. Now, about the project. It's been a 3-year collaboration of Enfold with Ford Foundation on bringing comprehensive sexuality and personal safety education to academic institutions. As an Enfoldite, I'm delighted to introduce Enfold to you all. Enfold Proactive Health Trust was founded in 2001 to promote gender equity, sexuality, and personal safety education to create safer places and prevent sexual and gender-based violence against children and adults. Enfold works in multiple teams. Enfold's prevention team conducts gender equity, sexuality, and personal safety education for children, including children with disabilities, college students, and adult stakeholders. The support and rehab team work with children who have faced sexual violence by assisting them through the criminal justice system, conducting training on POCSO Act, workplace sexual harassment, and redressal mechanism. The restorative practices team facilitates circles and trains child care institution staff, school teachers, social workers to build a restorative culture and address conflict through restorative practices. The research team works on child protection issues to advance child rights and implementation of laws. From its inception in 2000 till March 2023, Enfold has sensitized over 2.27 lakh children and adolescents in across 1,000 schools, colleges, and childcare institutions. Around 72,000 plus parents and teachers support staff have been covered over 60 cities, both rural and urban areas of India. And this also includes around 2,500 and above adults reached under the Suvidha project for persons with disability. We have our founder, Dr. Sangeeta Saxena, with us today. Dr. Sangeeta Saxena is a gynecologist, author, and activist. Along with Dr. Shoaiba Saldana, she co-founded Enfold Trust in 2001 to further gender equity, sexuality, and personal safety education. A co-author on the On Track Workbook series, Dr. Saxena established graduate and postgraduate courses and led to the development of Suvidha Kit to explore these topics with children with disability. Dr. Saxena works with several state governments, national and international agencies to further sexuality education and frame policies for child safety. And since 2018, she is exploring restorative practices. So I'm going to hand it over to Dr. Sangeeta to commence today's event. Over to Sangeeta.
Sorry. Thank you, Shiva. I will give a brief introduction to comprehensive sexuality education as well as the Ford project that we did. And yeah, so going ahead, what is CSE? And that's the short form I'll use, CSE and PSE for this education. There are many guidelines about it, many descriptions. We have used the UNFPA, and what all you see in the brown color is from the UNFPA document. What is in purple is what Enfold has developed over the last 20 years. It is a curriculum-based approach, so it is in schools, graded according to age. It is a set curriculum, which of course evolves. It discusses cognitive, emotional, physical, and social aspects of sexuality, health, and well-being in that context. In India, we have felt free to link it with spirituality, and I really feel that it can be done. That can be done wherever it is culturally relevant. We do talk about the body as being crafted by nature, And if children say it is made by God, that's absolutely fine. Uh, Respect for the body and all its functions is also something that we bring out. It encourages respectful social and sexual relationships, consent, dignity for all concerned. We talk about dignity and respect for oneself and for others. We also talk about people of all sexes and genders are equally human. We don't go into this bit of who's equal to whom because obviously there are differences for obvious reasons. We discuss respect and root it in one's values, behavior, experiences, skills, and how one is being. Uh, the curriculum supports informed choices, enables agency and autonomy. We increase the self-awareness, and beginning from very young children in primary school itself, we talk about how every action or inaction is a choice and we can be responsible and accountable for it, and this is borrowing from the restorative practices. We encourage one to be a safe responder in the context of sexuality and especially in the context of sexual and gender-based violence. What's the need? We all know. But the basic one is the attitude towards one body and sexuality, how to get over the shame, guilt, and silence that many cultures put it on the child right from the time the child is born. Childhood sexuality, their questions, their curiosity is not addressed. At the same time, there is rampant child sexual abuse in many countries. Puberty itself is shrouded in myths, shame, misconceptions, and comparisons. Diversity is rejected and discriminated against. Rights of the persons of disability is hardly regarded as a right. And this all leads to unsafe sexual relationships, gender-based violence, and on top of that, victim blaming. Reproductive health itself is shrouded in myths. At the same time, there are online and social media educators all around. Teachers and parents shy away. The lack of this education also impacts the quality of laws, policies, and services that we offer to our citizens. Elderly sexuality is hardly recognized. We do separate CSE and PSC because PSC is more acceptable and with younger generation, with smaller children. And we also want to bring out the distinction between sexuality and reproduction because many a time it is confounded. What are the principles of PSC? It's a right to information, accurate information, and gaining knowledge, which comes through shared experiences. People, when they share their experiences, they have a right to safety and dignity. We present the world as a safe space. And we emphasize that humans are designed, and this is neurobiologically true, to be good as well as see good, be good, do good. Personal safety rules and guides would enhance one's safety, not ensure it. Personal safety is a community's responsibility, not the child's. And it's respectful. The education says no shame in any part of the body, but how we use our body can bring us respect or otherwise. It is made culturally acceptable by using words and analogies that are accepted in our homes. So we don't insist on using words like penis, vulva, vagina. Instead, words like susu and potty, which are understood by most people and acceptable, which would lead to a clear reporting and understanding of sexual abuse if the child were to say it. That is what we want, rather than words like flower, parrot, or cookie. It's fair. We talk about responsibility and accountability of the one who broke the rules willfully. And the same thing continues for CSE, for higher grades. Here, we emphasize diversity, how it is a norm in nature, how all sexes undergo similar pubertal changes with varying degrees, and that there are more similarities than differences between us. Again, respect for the body and consent and all of that. And to make it culturally appropriate, we talk about how our behavior, our words, our actions are a description of ourselves, how we create ourselves in our actions. And they have hardly anything to do with the object that we are talking about or the person we are talking about. It's fair again, responsibility, accountability, and we are looking at communities' restorative response to sexual and gender injustice. Stakeholders are all and sundry. I want to draw your attention to media, journalists, advertising agencies, internet content developers, donors, corporate houses, religious and spiritual leaders. I think this is a group that can do wonders. Of course, our law policymakers, government, law enforcement, all of these come in to play. Of course, children in school and out of school need to be reached, as do the youth. The project, the Ford Foundation project, was aimed at ending all forms of sexual and gender-based discrimination and violence, especially faced by the marginalized groups as well as women and girls. Of course, we extended it and made it for all children and adults. We wanted to reach the family, the community, and the workplaces, and we thought it is best done through graduate and postgraduate students in colleges, in streams that are more likely to be engaged with children and adults who may have faced sexual or gender-based violence. So we thought we will train their teachers, and you will hear from them. And then these students would be able to utilize their learning in their personal and professional lives. This project was done during COVID times. We identified these 6 disciplines: education, special education, social work, psychology, public health, and nursing. And we went to colleges where we already had connections to do this work. There was no way we were forming new networks during COVID. There was all genders were part of the project. We spent the first 6 months developing resources, which I'll show you in a minute. And the next 6 months in training teachers. 18 teachers underwent the intensive DS training of 30 hours plus another 30 hours of mocks, and then finally observation in the classroom. And 21 teachers of nursing and public health underwent the abridged course. And then the student training began, which the teachers did, and we observed them. This continued for the year 2 as well. And through the year, we had capacity building for teachers as well. The last 6 months or more was spent in data analysis, report writing, conference, and you will hear about that from Vinalini and Elrida. So what are the resources that we have for you? It is all here under the resources tab on our website. I can show you there are PPTs on various topics. There are also 16 videos. There are 16 videos in Indian Sign Language as well on various topics, including how to talk to children about personal safety and discuss sexuality with adolescents. These can be watched at any time. You can also download and read these publications, which are the Demystifying Sexuality reference book, as well as the 6 handbooks in various for the various disciplines, the 6 disciplines that we talked about. So with that, I want to say thank you. And over to you, Shiva.
Thank you, Dr. Sangeeta, for the insight on the need for CS and PSE. And you mentioned the holistic involvement of various stakeholders. So we are coming to that. We have a few stakeholders who were deeply involved in this project, and I'll be introducing them to you, and they will be sharing their experience. So just note to the speakers that I would be, there'll be around 9 minutes talk time for everyone, and I'll also give you a heads up when it's close to the talk time. All right. So let me first extend my warm welcome to 2 members of the Martin Luther Christian University, Shillong, Dr. R. Jennifer Ward, HOD, Center of Gender, and Dr. Arunister Lingdo, currently an assistant professor in the School of Social Work and Controller of Examinations and Evaluation in MLCU. So welcome, and please share your experience with us. Thank you.
Good afternoon. I'm happy to share my experiences on behalf of the faculty trainees at Martin Luther Christian University. The journey of 3 years with Enfold on demystifying sexuality has been one of unlearning and relearning. Along the way, we unpacked many ingrained stereotypical mindsets on gender and sexuality. We were able to reflect on how patriarchy has also steeped into our Khasi matrilineal system. This slow infusion took place over generations because we were silent, because we did not call out. The training helped us to embrace gender diversity and be expansive in our thoughts and actions. We are reminded of the importance of using sensitive and gender inclusive language, and most importantly, to make a conscious effort in our daily conversations. We were able to echo on the topic of how gender bias can affect all genders every day in many spheres of our life, and one of the underlying reasons being toxic masculinity and femininity. Through the lens of intersectionality, we were able to understand how different aspects of one's identity intersect and overlap, which can in turn impact experiences of discrimination, inequality, or privileges. The lens of intersectionality helps us become conscious of those forms of prejudice and oppression that are visible or invisible, not too evident, or not spoken about openly. The overall experience was enriching as well as liberating and helped the participants view sexuality as positive, devoid of shame and guilt. At the curriculum level, we have benefited from the rich resources provided by Enfold. We are grateful for the interaction time with the various resource persons, the videos, the PowerPoints, the manual, and the handbook. These resources have enriched our gender and sexuality curriculum at our university. This training has also supported the upskilling of our colleagues and broadened our perspectives. At the end of the day, we need to acknowledge our bias. For acknowledging not only helps to unmask any bias that is implicit in our views, but it helps to provide a way of responding critically and sensitively to any issue. We are glad to join hands with Enfold to promote comprehensive sexuality and personal safety education. Thank you for your time.
Thank you. I'm Dr. Arunistalindo. I'll be sharing my experiences throughout these 3 years that I've been involved in the project. Involving in the building the capacity of teachers in sexuality and personal safety education in this period of 3 years, 2020 to 2023, we have been gone through various processes which have already been mentioned by Professor. We have gone through 30 hours of the teachers training courses, and we have also had 30 hours of practical mock training and feedback, monthly capacity building sessions, and practical sessions for students of psychology and social work on various topics. And we have also been able to develop the demystifying sexuality manual of social work. Okay? And all of these experiences has broadened our perspective towards gender and sexuality. And there is a lot of unlearning happening and new learning happening. And that is possible only through the practical sessions and the mock sessions that we were engaged in, and the regular capacity building sessions that we had, and the constant guidance and constant feedback given by our facilitators. Yeah, thank you.
That was quite a 3-year experience, Dr. Jennifer and Dr. Arjun. Thank you for sharing that with us. I now welcome Dr. Greta D'Souza. So Dr. Greta D'Souza is from Christ University, Associate Professor and Head, School of Education. And her areas of research and expertise include adolescence education for children, pre-service and in-service teachers. She has worked and visited universities abroad that include China, Hong Kong, and Miami. Dr. Greta, over to you to share your experience.
Thank you. Thank you for this opportunity, and greetings from the School of Education, Christ University. I would be representing the work that we had completed during the 3 years at the School of Education, Christ University. In the year 2020-21, 5 teacher educators participated in the teacher training that was provided by the Enfold team. And we were very happy to participate and also understand the different perspectives that went into in-service teaching as well as pre-service learning. The teacher educators then planned, implemented, as well as evaluated the transaction of the modules. This was curriculum-based, especially for the pre-service teachers, which took into consideration gender equity and personal safety education. So we provided the personal safety education in the second semester of the pre-service teacher training program at the university. So the students of the Bachelor of Education got an opportunity to interact with the Enfold team when they visited the university and also equipped the learners through their modules. That was in 2021. In 2022, the team also provided with personal safety education materials, Enfold's educational apps, as well as the facilitation guide, which would help the teachers to not only look at the modules, but also to transact the modules, which were of 3 types: 1 to 4, 5 to 7, and 8 to 10. In the next year, the master trainers of the previous cohort provided the students with these modules, which was also monitored and feedback Enfold team. Now, this went on to the next year, where these students, it was a team that was prepared, led by the students who provided these modules to the junior cohort. And I'm very 2023, we also conducted a service learning project where the modules that were facilitated by Enfold were made as a provision for the school children that we had undertaken. And we were able to, all the 90 students to enter the school and provide
there seems to be a
Dr.
technical
Tony
glitch. Dr.
Chandramouli.
Greta, we can't hear you.
Now, can you hear me?
Yes, yes.
Now, can you hear me, please?
Yes, Dr. Greta.
Yes. So I think I missed you when I was communicating to you about our service learning project. So the same modules were taken as a service learning project to one of our schools, where all our 90 students who had learned this as part of the curriculum were able to take forward these modules to the school children. And we got a lot of appreciation for having helped our pre-service teachers to learn from these modules. I thank Enfold. I thank the management of Christ University for giving us this opportunity. And I'm happy that our Dean Dr. Tony Sam George is also present at this meeting for having given us this opportunity. And I hope the pre-service teachers, the in-service teachers of school children. And we thank you for this opportunity. As we learn, we live, and let's live. Thank you.
Thanks, Dr. Greta. Thanks, everyone, for sharing your experience. It's reached a lot of schools, teachers, and it's great to hear that. A quick note to all the speakers who are going to come in: if there is going to be a bandwidth issue and a technical glitch, then you are free to turn down your video, and we would love to hear from you. So we can use that as well. So now. Start my video. Can you hear me? Yeah. All right. So, yeah. So if many haven't heard me, what I was trying to say was a big thanks to for Dr. Jennifer, Arden, and Dr. Greta to share their experiences. And for the speakers, if there's going to be a technical glitch in the bandwidth issue, you can turn down your videos so that we can hear you clearly. All right. Moving on to the next segment, we are now going to meet Dr. Vinalini and Elrida to share the outcome of the 3-year project milestone. So I'm going to have a quick introduction of them to you all. So Dr. Vinalini Matrani, a research consultant, 35 years of experience, specializes in gender, education, and health. She has collaborated with organizations such as UNICEF, Be World, and more. Currently, she is assessing the impact of gender, comprehensive sexuality, and personal safety education project with Enfold, and she is also into various other research activities. Elrida Rita Lewis is a psychologist, impact researcher, and a content editor writer. She is having master's degrees in clinical psychology, investigative forensic psychology from Bournemouth University, UK, and a postgraduate diploma in criminal justice from the IGNOU. She has volunteered and worked with various institutions and NGOs for over 10 years, primarily in the space of child rights, women's rights, and children in conflict with law. So this 3 years effort from everyone involved in the project is compiled into a report, and I welcome Dr. Vinalini and Elrida to release the report. So over to you all. Speakers, Dr. Vinalini and Elrida, you have around 28 minutes on the floor where you could probably have the last 8 minutes for audience Q&A. So audience, any Q&A specific to the report could be asked in the chat box during this time. Thank you.
Thank you so much, Siva, for that kind introduction. And Prachi, do let me know if I go too fast and I will slow my speed down. It's just that we don't have so much time and it's 3 years of work. So firstly, I really want to thank all the speakers before this for sharing their experiences of this intervention. And, you know, if we are talking impact assessment, I think you'll have already really told us what the impact has been, especially Jennifer, you know, you use such interesting words like enriching and liberating. I think that really speaks volumes for the impact. And also, you know, the fact that Lindo said it was unlearning. I think that these are all really going towards meeting our objectives. And I think Greta gave us an excellent overview of the whole program. So I think all of you by now already have a good sense of what this whole intervention was about. So let me just give me a second while I just put up the PPT. Yeah. So I really want to talk about our impact assessment in the context of the global coalition, because I feel, you know, if we are to work together on this cause, let's look at what our intervention did and how it can go towards promoting this global coalition. So firstly, I just want to walk you through what we'll be doing in the next 20-25 minutes. I'm not going to read out each thing because I'm going to take you into it in detail very shortly, but this is just to give you a sense of where we are going. So I'm going to start saying, you know, if we are of intervention research plays really critical role, definitely assess the impact. And once you assess the impact, then the study comes out with recommendations, which allows us to review our strategies. And then we re-strategize. And when we re-strategize, we need to look again at what is happening with these new strategies. And so it's like a spiral that keeps, you know, going up. And it just keeps the whole intervention completely reflexive. And if we have actual good sound data to back what we are doing, then we become credible. It becomes justifiable. And then people talk of upscaling it. So all the intervention research really strengthens our endeavor and it promotes a buy-in. So if we are talking about this at a global level across the country, across different parts of this world, then it also becomes an opportunity for us to learn from each other, because there are so many innovative ways of doing research. And we really need to share these methodologies rather than, each one of us reinventing the wheel again and again. And it is the outcomes again that we ought to share, that, this is what makes us learn better and understand better. So I'm really putting this up front, saying that if we are getting into this global coalition to work in this area, we really need to make intervention research very much part of our work. So now if I take you to the study that we did, you've already got a very good sense of what the intervention was about. So we very clearly followed a training of trainers approach, where it was the Enfold facilitators who trained the teachers in turn trained the students went out and used this, they got the opportunity to use these inputs. And what our role was really to systematically and concretely understand the impact. So you already have got a good sense of the impact from what three previous speakers said. Now this is from the research point of view. So essentially what we did is we tried to understand where the teachers and the students were at the baseline before they were exposed to the course in terms of their attitude and knowledge base towards all these various domains that the Demystifying Sexuality course covered, and how it shifted 3 years down the line. So it was completely time bound because this was a 3-year project. So we engaged only for this 3-year period, which means that all that we can present to you is the short-term impact. And really, the short-term impact is just the tip of the iceberg. So yes, we are going to see positive outcomes, but I'm sure there are many more positive outcomes waiting to come. So in that context, I just find this WHO quote so relevant, because it says that studies that reveal the impact of these interventions may not be immediate or easily measurable. Immediate, we've already said that this change or internalization of these concepts, which are fairly complex, do not happen immediately. And also sometimes they happen when the opportunity arises. And then you go within yourself and bring to bear the kind of learnings that you acquired in your student journey. And they are also not easily measurable. How do we track somebody who learned something in this course 5 years down the line uses it in a context of child section? How do we track it? How do we measure it? These are big challenges that as researchers we do face. And also long-term effects often become evident later in life as students apply this knowledge and skills acquired in their educational journey. So again, I'm going back to the coalition and I'm saying, if we are to work together on this, can we please bring longitudinal studies to be very much part of our agenda? Because that's where we will really be able to understand what is happening. So that's just to give you a backdrop. Now, these are the titles of the research outputs that came out. As we said right in the beginning, this is all about capacity building. We have 2 volumes that we brought out. So one was on teachers, which looked at the impact of this course on them and what kind of shifts happen from baseline to endline. So that is our volume 1. And in volume 2, we looked at the students and the kind of shifts. So part 1 looks at the shifts that happen, and part 2 looks at the evaluation of the course itself. And this was perhaps an add-on, but we felt it's very important for the students who are the most critical point, because it's from them that this whole thing is going to go, further and further out as they work in these various professions that Sangeeta already told you about. So this actually gave us some really very interesting inputs, because even as Enfold, we need to understand how they are internalizing and how they are viewing this course. So research objectives, I just want to say that, we produce these 3 big studies and we have multiple research objectives, but I'm just going to focus on a few. And if you want to know more about the other objectives, do read our reports. So firstly, we wanted to understand the nature of shift, which I've already told you about. Then we wanted to look at preparedness level. And here, when I'm talking of preparedness level, for teachers, it means their preparedness to actually be able to teach this course and how prepared they feel to grapple with it. While with students, it's their preparedness to deal with this as professionals and in their personal lives as well. So there are 2 different aspects of preparedness that we looked at. then we wanted to say that, it's not, let's not focus on all the things that worked well and all the shifts that were positive. We also need to know what was challenging, because it is sometimes these very challenging areas which are the most important because they are so difficult to deal with. Then what were the students able to use in their lives, both professionally and personally? What did the teachers think of Enfold's training inputs? Because again, this is very important. It's their perception and it's their internalization, which then takes this further and further. And then what kind of inputs do teachers and students still need? What was the student perspective on different aspects of the course? And ultimately, what was their satisfaction level? So this is really just a very broad overview of our objectives. Now, in terms of the methodology, we chose to use a mixed method approach for the obvious reason that if you have a mixed method approach, then you get a more comprehensive understanding. So our questions were both qualitative and quantitative in nature. And before I get into what these methods were, I just want to tell you a little bit about the sampling. It was a kind of conscious decision on our part that let's try and do a universal study, because universal study really gives you such a good understanding of the whole picture from so many students, so many teachers. So we had some teachers who stayed with us right from the beginning to the end. So there were 17 from here, and we also Enfold also ran this 2-month abridged program. So we had a number of teachers who were trained there. We wanted maybe 3-4 more teachers from there to be part of this, but we could not reach out to them. So this is as comprehensive as we could get with these 17 teachers. And with regard to the student impact assessment and student course evaluation, we were able to get more than 80%. So it's quite a large study that we did. And we conducted 2 different things. So with the students, both for the impact assessment and for the course evaluation, we conducted a survey, we developed a questionnaire, and this was administered online through self-administered Google Forms. For the teachers, in addition, we did some interviews. Then we also sat in actually and watched what was happening in the classroom. So we were able to see how the teachers are teaching, how the students are internalizing the learning. And what I really want to do is, I want to tell you a little bit about what went into the making of these questionnaires. Because, the thing is that as researchers, we cannot afford to be ignorant of this whole domain. To be able to do a good job, we really need to know the content of the course itself. So in fact, my colleague Elrida did a very deep dive into the demystifying sexuality manuals. She actually, went domain by domain, subtopic by subtopic. And over there, what we did is we developed 1 statements, then we had questions, and then we had case scenarios. And we developed these into ways of understanding what the knowledge base was and what the attitude was of the teachers and the students before the intervention. And then we use these same questions at the end line to see how it had shifted. So this was something that we could not do alone as researchers. We had to work very closely with Dr. Saxena and with Smita Chimanda, because we had to understand from them what is it that they really wanted to convey, what is it that they really wanted evaluated. So they worked with us, and I'm dwelling for so long on this aspect, because this is what makes intervention research effective. We cannot work alone as researchers. We have to work with the people who are conducting the intervention, and they were most helpful in giving us constant feedback. We went through so many reiterations to reach where we reached finally. Then this whole thing was executed against the backdrop of the COVID pandemic. I do not want to dwell at length about what it means to work in the context of the COVID pandemic, both for the teachers, for Enfold, the team, for the teachers, for the students, and for us. So I'm just going to, leave it at that. So now let me just start with the student evaluation course findings. So I'm going to flag the key finding really upfront. The course was effectively and efficiently executed. That was a clear finding from various things. And, when Elrina and I were working together on this presentation, we said, we don't want to bore the audience. We don't keep talking about numbers because it becomes so tedious. 30% felt this, 40% felt that. It just can be mind numbing. Then we looked again at the data. And then what we really found is that, because if we work with you thematically and take you through themes and then say 40%, 30%, nothing is going to register. So we said, let's just invert that whole thing on its head. Since this is a quantitative study, since numbers do matter, what if we try and tell you the story through the numbers? So first finding is that I want to say we start with 60%, which I think that in itself is really so this is not thematically presented, but this tells you that 60% found all this relevant. Then the story gets better. 70% said that teachers explain the concepts clearly, they encourage questions. That goes for, again, credit to the teachers, credit to the Enfold team for being able to make them so confident. And 70% of the students felt that they were prepared to enter the field without inputs. More than 80% was satisfied with the course, and then we get even better. 90% said it brought new learning. I really want to dwell on this thing of new learning because that means a lot. That means that it has really given these students a new way of looking at this whole domain, which I don't know, perhaps they really never perhaps gave that much thought to it. And they said they had no problems in comprehending the course. They felt comfortable with the topics. Some teaching methodologies were more useful than others, which again is to be expected. And my very last thing is there were few or no logistical complaints, which is again creditable because of the COVID pandemic. And logistics, believe me, is so important. You can have the best content, the best teachers, and if the logistics are not in place, the whole course can fall apart. So that's the beginning. Now, if we look at student and impact assessment findings, so I just want to tell you that we have two separate reports for this. But we have chosen to bring this presentation to you in this form because this is a trainer of trainers model, and let's see what happens. What kind of absorption and filtration happens. And if you look at this, basically through this table, what we are trying to show is that in all these domains, there were positive shifts for both teachers and students. And it's quite clear that the positive shifts were more for the teachers as compared to the students, which is again part of the TOT approach. But still, I would say the students have done quite well in terms of the shifts. So that's our key finding. Secondly, I want to say that, in each of these domains, there are multiple subtopics. Now, it does not mean that the teachers and the students, where you see a green, they have done well across all subtopics, but at least in one or more than one subtopic in this domain, they have done well. So in this table, I could not show you all the subtopics because it will run into 5 slides and nobody has the time for this. But in the next slide, you're going to get a sense of what these subtopics are. So this tells you that, yes, largely there were positive shifts and teachers did better than students. Now, if we go to the next one, this is the challenging areas, which I told you in the objectives, that it is important for us to flag these things as well. We cannot ignore these things. Now, wherever you see reds, it means that this was challenging. So these are areas that we need to really think about. Again, I hope it's clear. Lata, is it clear on your screen, or do I need to read out subtopics? It's clear. Okay, so I'm not going to read out the subtopics, but this is to give you a sense of what kind of subtopics feature where. And these are challenging areas for students, not so much for teachers, but for students, yes. And I do want to say that it is important for us to bring this to the attention of the coalition, that these are important and difficult areas. So let's not try and get away from it, but let's try and acknowledge it. And it also means that, when we work with these areas, when we teach them, perhaps we need to teach them in a more innovative way. Perhaps we mustn't use just straightforward lectures or PPTs. We need to use role plays. We need to, something which will make people really think about it rather than just react to it. There's a tendency for us to react to something that we've just been dealing with or thinking about for many long years. So I'm just flagging these as concern areas for us to take forward when we work in this coalition. Now there are a whole lot of small things like, we looked at shifts in preparedness. This is an interesting thing because this is self-reported. And if you look at that little box over there, it seems that the teachers were less prepared at the outset as compared to the students. But this is also self-reported. So the students thought at baseline level, yes, we are prepared. But perhaps when they did the course, they realized, actually we are not prepared. And now we are much better prepared at the end line. So, look at this data with that kind of a caveat. Now, in terms of training components, the training that Enfold delivered, most teachers were satisfied. Students and teachers found that it is of practical utility. Teachers actually found it to be practically useful while teaching the course. And students saw the potential for this kind of thing being used in the future. They appeared, 64% said they were comfortable with all the topics. And here I'm just going to put these two points together. Additional inputs for teachers. 41% said that they wanted additional inputs. And if you look here, it seems that fewer students as compared to teachers wanted additional inputs. So I think what we really need to focus here is that clearly the teachers have a thirst for further knowledge. They do want more inputs for very specific reasons. And for students, maybe this is, while teachers are looking for this, students got this. I don't think they attended this course saying we need all this information. They just got it. And it was revelationary for them and it was useful for them. While teachers want more to be able to teach better. I think that is actually a positive finding. 82% of the teachers had no concerns. And this is perhaps the most interesting thing. 94 teachers felt confident. Again, it is credit to the teachers for their dedication to this and to the Enfold team for being able to create this level of confidence. And in terms of challenges, 88% students said they had no challenges. So I know this is a lot of data and it's all very hard to absorb, but sum total is that it's not a perfect scenario, but it's an extremely good scenario in terms of an intervention like this. And it also creates hope that yes, this can be done, because now we have, it's like a, what do you say? It's a proof of concept. It can be done. So things were good, but we did have a few recommendations. How much time do I have? Can we go into recommendations or should we?
Yeah. We have time till 15:40. So,
okay. So we have another 5-7 minutes.
Yeah.
Okay. Thank you, Shiva. So recommendations, I just want to say that, see, these recommendations that we have developed actually came out from multiple sources. It came out from our data collection sessions and came out from our, reflection sessions as we process the data. It came out from watching the teachers in operation while they taught the course. And we also sat in on some of the mock sessions. So what we did feel is that different teachers had a different level of readiness. And perhaps the mock sessions where they learn how to teach the course could be monitored a little bit more closely. Also, the teachers were given the luxury of developing some of their own PowerPoints and some of their own methodologies. And perhaps this could be checked a little bit more closely to make sure that it is factually sound. They also expressed the need for refresher courses in challenging areas, which Enfold could do for them. And they could equip the teachers with a range. So they did use, I would like to say they used about 5 to 7 different types of teaching and facilitation techniques, but they could use still more innovative ones for the challenging topics. I'm going to take your mind back to that red slide, that perhaps those topics need to be approached with a different set of facilitation methods. And all the resource material is up. It's extremely detailed. It's extremely relevant. But again, if we are to say we are engaging in intervention research, let's look at the more challenging topics and say, can we develop more interesting additional resource material for those specific topics? Also, they clearly do need a support mechanism, which does not have to be daily handholding, but it could exist in some kind of online way, or there could be like a WhatsApp group or a portal where they can post questions. Something could be done just so that they feel supported, largely because this is a complex area and also because we are all still learning about this domain. And I feel this thing of a local context is very important, because how sexuality is understood and approached in each local context varies. So we really need to then, like, Enfold also needs to learn from the teachers about the local context and then help them to translate it into good teaching material. And I mean, I also want to say, these are recommendations that the research team is putting forward, but we haven't arrived at these by ourselves. We have worked with the Enfold team to reach these recommendations. And one of the things, in fact, that they did suggest when we said, there is learning loss in a TOT methodology. And to which, in fact, it was Dr. Saxena who said that, we are thinking of doing something along these lines because we understand this happens. And we could think of a self-learning app, which then they feel supported by. There's all the information is there. They can access it anytime. And this is the era of technology. People do like to use these kind of mechanisms to learn, to enrich their knowledge. And they could enable like a peer-to-peer discussion or a student-teacher discussion through this self-learning app. Now, for the teachers, one of the things we felt is, like when you learn a new language, you can't just teach it as a subject. You have to actually tell the students, now you have to speak the language. So even with the course, like with the area like this, you cannot approach it as a subject. You have to teach it as an area of social change. So there's a different way in which you teach it. Like there has to be a measure of gravitas. If you're talking about child sexual abuse, the mood should be that of, child sexual abuse is a serious violation. It cannot be taught just as information. So the teachers need to understand that this is something that we felt when we sat through their observation sessions. Also, we did find that a lower, a more suitable teacher-student ratio really helps because this is a complex area. Students may want to talk, they may want to participate, they may want to engage, and they don't have the time to. If there are 90 students in a single class, it is difficult. So we did find that a good teacher-student ratio of maybe one teacher and 20, 25, 30 maximum students does help in engender better learning. Also, students need repeated inputs because if you just give them this compressed package in one shot and leave it, and then it's just like sometimes too much information to absorb at one time. So we need to keep that in mind. And perhaps additional DS resources to complement their learning. And again, this goes back to facilitation techniques. They need to seek out teaching inputs which will help to break the tedium of classroom learning. And that, again, this relates to our previous slide where we talked about a peer-to-peer teacher education program. So I want to thank all of you for patiently listening to us. As researchers, for us, what really matters is when people listen to our research findings and sitting through that thing with us. So, now what we would like to do is release a report. So Antara, if you just you'll patch so Antara is going to paste the report links in the chat box for you now. And while she is doing that, I just want to show you that this is what you need to look for when you go online. These are what our reports look like. So the volume 1 is about the teacher experience and volume 2 is about the student experience. Yes, I mean, so I was just trying to look at some of the questions that have come. There is one question which is, can we request the participants in the study? Who are the participants? Sure. The participants were the teachers and the students from the various colleges that Dr. Saxena told you about. So we had Christ University and we had B.Ed students from there. We had Martin Luther Christian University, and from there we had social work students and we had counseling psychology students. And then from SSK, which is Spastic Society of Karnataka, we had students of special education. So Enfold facilitators train the teachers from all these colleges, and the teachers in turn taught the DS course to all the students that I just mentioned. So that those are the parts. That's it. Okay. Should I just have a look at the chat box? Okay, so yes, so this preparedness question, Anna, yes, we did have a scale. Like, do you feel, how prepared do you feel? So it was like that Likert kind of scale. Do you feel completely prepared, somewhat prepared? That was the kind of approach that we used. So it was purely what they felt, and it was reported along a scale. Okay, so I don't see any more questions, and thank you for your comments. I can see some nice comments have come up. So somebody's asked, can you elaborate on the difference between knowledge and awareness? So that's actually a beautiful question, because, you know, knowledge is something you know, but you know it, but you may not be aware of it. So there are actually, you know, research techniques to help people shift from knowledge to awareness. Like, I know I smoke 20 cigarettes a day, but I may not be consciously aware of it because I just smoke 20 cigarettes a day very mechanically. But if you sit down and make me reflect, and then I look at this and I say, oh my God, really? Do I do that? And that makes me aware of, you know, the implications of smoking those 20 cigarettes. So knowledge is something you know. Awareness is something that's, you may know something, you may not act on it. But awareness is something that you feel like acting on. So I may tell you, you know, don't drink or don't talk rudely. But until you become aware that you're doing it, you're not going to change your behavior. So I would say knowing something is one level, of being aware of it is another, and then that awareness will make you act on it. So the behavioral change will happen only if you become aware of it. Apart from feedback on the program, did you conduct a baseline and post-program measure of knowledge of the students? So, that is what our impact assessment was about. That was, we really saw what did they know at the beginning and how did it shift. But we had to, you know, develop very interesting kind of ways of finding out. So our case scenarios, the statements that we developed, that is what showed the shift in knowledge, because that was they were constructed in such a way that people would not realize, it would reflect their attitude without them realizing it. And then we also often found contradictions, because they said we are completely prepared in this domain. And then, you know, when you look at the impact assessment, you find that actually, no, this is a difficult domain for them still. So that's how we checked and counter-checked different aspects of people's understanding and exactly the difference between knowledge and awareness. So they think they know, but actually they don't. And that's what we were able to access. So, I mean, if you read our reports, which are really triangulated, there's a lot of data triangulation where we have taken information from one data source, try to match it with another data source to see where does this corroborate, where does it contradict. I think that's what the strength of these reports are. So it will be great if you read it and see exactly what I'm talking about. So how do these students who were trained in CSE provide CSE to children or adolescents, or how do you assume they will reach children? So, you know, the thing is that, again, this is a short-term study. So it is very difficult for us to really say that, yes, this kind of dramatic change happened, because all that happened is that these students, they went out and did these 2 months. Sometimes it was a 2-month internship. Sometimes it was a 1-month internship. And that is all that they could do. So we need longitudinal studies to really say how these things will actually be used. I think that's about it.
Dr. Vinalini Nelrida, that has been such a valuable asset, full of methodologies, assessments, and recommendations. And I totally understand that it's going to have a long-term impact on students and the teachers who have gone through this experience. Thanks a lot for it. A quick note to the audience, are there any more questions on the chat? So yeah, so if um, if there are no more questions, so we are going to take a break. This is break time and we are going to join back at 3:45, 15:45 India time. And we have a few more interesting events like spotlight sessions, panel discussions, audience Q&A, and be back for that at 3:45. So see you all soon. Thank you.
For those of you who will remain tuned in, they will show a short video about Enfold's work. So, hold on for that.
consequences caused by a lack of awareness about amongst adults and children. They decided to do something about it.
Enfold started its work initially in working with children and schools, specifically in the area of life skills, which is a very important part.
Enfold has reached over 70,000 children in 150 different schools in various towns and cities.
Related with Enfold for almost 8 to 10 years now, and what started off as a small workshop for children on creating awareness, and after which we found the program to be very, very useful, especially because it kind of sort of broke a lot of myths, and it also probably helped children to kind of clarify their own doubts which they had in their minds. So we had our teachers of classes 1, 2 and 3 having the workshop together, then the middle school and then the high school and even the senior secondary children. And their problems are very, very different from probably a 6-year-old. And these workshops sort of opened the minds of the teachers, and they also realized that it was very important for them to discuss it in class if there was an issue, rather than sort of weight track it or probably not answer the queries of the children.
It's really interesting and given us lots of information what we were not getting it, actually knowing about that. Main thing about the child awareness and how we should be with the children, how we should bring them up.
It's very wonderful, really. It was something eye-opener for us actually, because none of the people who are staying here are also not very educated, and they're not aware of these things, and very good just coming from this place where I don't think anybody hardly steps in seeing the environment. But
it's our responsibility to provide a secure environment for our children, and they understand the difference between safe and unsafe touch. As parents, our role does not end in kind of deciding what they want to study, what they want to do, or anything like that.
Your cousins, they'll touch our body, then they'll say that you come to my house, I'll take you, I'll give you chocolate and all, they'll say, and they'll take out and they will do the bad things.
So what do you do when somebody does a bad thing?
We say that don't touch me, or you don't have any rights to touch me. Who are you to coming in my house? You go stand out. When my elders, my mother, father comes, I'll say that you have come. I'll say you talk to them.
As a counselor, I've had students who've reported abuse, and they were very open about it, and they knew when to approach an adult. So it has definitely helped them to become aware of the situations, and go and ask for that help whenever it is required.
Child molestation and sexual abuse is a serious societal malaise today, because unless we protect our children and give them a life they deserve, we will be destroying our society.
So I think there's a deep concern about child safety, and there's a need for people to work on setting child health and safety standards, so that there'll be a code by which they could be measured, and there'll be a code by which they could follow and set in place processes so to reduce any adverse impact it could have on children.
Enfold has also gone on to actually create a public visibility on the area of child sexual abuse, worked with government and non-governmental agencies to actually set up expertise and skills. On the one hand, on forensic interviewing of children, and on the other hand, setting up response units, which we hope to be one-stop centers where sensitive child interventions and inquiry is conducted.
Enfold has created the collaborative child response unit model of creating convergent training, a multidisciplinary team approach to child sexual abuse. We have come together to create a project which helps in training doctors, police officials.
All right, everyone, back from the break. I know it was an interesting video. There is a link to the video as well in the chat. You can view it. So welcome back after the break.
Dr.
Sangeeta, you
yes.
have
Dr.
share?
Chandramouli is in the audience. He is joined, so we could begin with his.
Oh, that'll be good. Thanks. Okay, so as I mentioned, break ke baad, we are going to have more interesting sessions, and the first one is a spotlight session, and I'm going to introduce Dr. Chandramouli here, and this will be we'll be discussing the global perspectives with Dr. Chandramouli. So I'll just give a quick intro. So Dr. Chandramouli works with the Adolescent Sexual and Reproductive Health and Rights, ASRHR as the abbreviation goes. And he's had a 30-year career with the World Health Organization and continues to work with ASRHR with a range of organizations. His work includes building epidemiologic and evidence base on ASRHR and supporting various countries to translate this data and into action through well-planned processes, policies, and programs. Over the last 2 years, Dr. Chandramouli has received USA Society's Adolescents Medicine and Health Life's Lifetime Achievement Award, the Rotary International Award for Outstanding Humanitarian Service for Outstanding Leadership, Scholarship, and Service in the Adolescent Sexual and Reproductive Health, and the World Association of Sexual Health Gold Medal, which speaks about his contribution to this field of ASRHR. Please welcome Dr. Venkataraman Chandramouli to speak on the global perspectives on implementing comprehensive sexuality education in educational institutions. So over to you, Dr. Chandramouli.
Thank you very much, and good morning, good afternoon, good evening, wherever you are in the world. In my brief presentation, I'm going to talk to you about the evidence for comprehensive sexuality education and different forms of evidence. The first is evidence on the need for and the effectiveness of comprehensive sexuality education. We have the revised international technical guidance on comprehensive sexuality education published by a number of UN agencies listed at the bottom of the document to the extreme left. Then you have the international technical and programmatic guidance for out-of-school comprehensive sexuality education, which has exactly the same content, but has approaches to deliver sexuality education outside the classroom, in the home, in the community, in different community settings. And then youth-centered digital health interventions. So there's evidence on the need and the effectiveness of different forms of delivery and content. And this is some two important reviews. One is a review by Fauner and al., published in 2014, which concluded that results from a meta-analysis I won't read out the whole text. You can have access to this if you want. But essentially, it says that as a result of participation in school-based sexuality education, students benefited in a number of areas listed on that screen. Another review is by Goldfarb and al. Published in 2021 in the Journal of Adolescent Health. And this one concludes that the results of this review provide evidence for the effectiveness of approaches that address a broad definition of sexual health and take positive, affirming, inclusive approaches to human sexuality. So the evidence, so there is conclusive evidence that sexuality education helps and doesn't harm for updating the international technical guidance on sexuality education. UNESCO carried out a review which looked at three things. Does sexuality education lead to earlier sex? Does it lead to an increased number of partners? Does it lead to more risk-taking? And the answer from this very clearly was no. And again, all this data is available in the public arena, and I could point it to you. The third item to point to is what does not work. You know, there's convincing evidence that peer education can contribute to benefits to peer educators and can lead to some increases in knowledge in some cases when it's well delivered. There is no evidence that peer education contributes to substantive changes in attitudes or in behaviors. Now, this does not mean young people have no role to play. It does mean that young people have an important role to play. For example, I'm 65 years old now. When I was 16, I started to have sex before marriage, and I would ask my friends, you know, where to get condoms from. But that is not peer education. That is, learning and getting tips from young people. Many women I worked with recall that when they were young women, they could tell each other which professors to avoid going to on their own. So that's not peer education. That's a life tip, a life hack, if you like, by somebody who knows the situation that you're in. So the other point is, there's a lot of talk that digital methods of delivering are useful. It's hard to deliver sexuality education in school. Parents don't talk about it. And so essentially what we need to do is to use the digital approaches. We have done randomized controlled trials in Peru and Kenya, and this is the findings are consistent with the findings from other places. No benefits. Digital methods on their own are not a magic bullet. They are at the best a complement to delivery of sexuality education by a trained, concerned, competent adult or young person, but who's trained and supported. Let me now move from research studies to programs. And I think this is very important. You know, in India, 2007, there was an Naidu Commission report, and that banned sexuality education. And now, still 16 years later, many states in the country still don't have state-sponsored sexuality education programs, which is such a shame. You know, countries such as Pakistan have done so much better than India because they have a national policy which enables sexuality education, which then has been operationalized by and the provinces. And we are still stuck with a decision made 16 years ago. Now, let me give you the example of Nigeria. Of course, you know, when we think of Nigeria, we often think about what is reported in the press and all the problems there. But Nigeria has 36 states, including Muslim states in the north, Christian states, and they have a national policy and they have school-based sexuality education, which has been rolled out throughout the country in all the 36 states. It's called Family Life and HIV Education. And on this slide, what you see is how they developed the national policy for scale-up. A group of NGOs demonstrated the need, the feasibility, and the effectiveness. They formed a national coalition. The coalition worked with internal and external change agents to contribute to a policy and a national scale-up plan which was funded by the Global Fund for AIDS, Tuberculosis, and Malaria. And so this was the national advocacy. And then they did advocacy at each state level to get support at the state level from parents, teachers, associations, and from other groups. Proactive, energetic, ongoing consultations. And that sadly is lacking. As I discussed with Sangeeta Saxena and her colleagues, some months ago, when the bags of school children were raided and they were found to contain condoms. This is in Bangalore, the Silicon Valley city of India. The girls were suspended and the state government was silent about it. This is a terrible shame. Let me now move to another state in India, Jharkhand, which was a small split off of Bihar, considered a backward state, but an NGO called the Center for Catalyzing Change has worked there and has scaled up sexuality education through the state. And the state government agreed after research carried out, multiple rounds of research. The organization was able to show the state government the importance of taking sexuality education to younger age groups. They showed that by 11th standard, children are busy with exams. They know they are not really interested in this, and we have to get this education out to younger students. So different kinds of evidence. Now I come to Pakistan. Pakistan has a national policy on sexuality education in place. There's little government-led implementation, and the group of NGOs, a loose coalition, has worked to build support for sexuality education by strategically choosing issues to address. There's a strong support among parents to teach girls and boys about sexual abuse because of high-profile cases of sexual abuse in the country. They frame their work with care. They use words that everyone agrees to. They have sensitive content vetted, not by religious leaders, but by a whole group of credible professionals, including religious leaders, using human rights as the analytic framework, and by actively reaching out to the community to explain what they were doing. And when they experience backlash, like they all do, from an alliance of media, politicians, and religious leaders, they engage supportive media persons as intermediaries. They arrange for journalists to visit schools and report what is happening, and they organize information sharing sessions. So in this way, they've been able to continue to work in a country which is becoming increasingly fundamentalist in its religion. We've also developed evidence to push back on misinformation. There's a huge amount of money coming out of the US from the evangelical church sponsored battle against sexual and reproductive health, against abortion, against comprehensive sexuality education, and the Institute of Research and Education based in Utah had published a report which said that 89% of international school-based sexuality education programs fail to demonstrate effectiveness. We published 2 papers demonstrating how bad their analysis was in their methodology, in their findings, and their conclusions. So we have to constantly develop different kinds of evidence. This is my last slide. Now I talked about Pakistan. So this organization called AHANG has been working to deliver school education in Sindh and Balochistan, 2 large provinces of the country. And as you see, like a snake and ladder game, they started in 1995. They introduced it in the community. They introduced it in private schools. They introduced a government pilot, a second government pilot, massive backlash. The floods in 2009 and 10 stopped work. Massive backlash following, not very different from what happened in India in 2007. And then the MOU was cancelled. They regrouped. They built support and got a third pilot in 2014. And then there was this case of Zainab, a terrible, brutal rape of a young girl. And so they used that to create community support, and now it's integrated in many parts of the country. So to conclude, what I'd like to say is that there is convincing evidence of the effectiveness of sexuality education, that it helps and that it does not harm. And there is evidence on different aspects of sexuality education that we need to gather. With UNESCO, we carried out a review of the state of global sexuality education. More and more countries have laws and policies that are supportive of it. It is much more still done in secondary schools, not in primary schools. Teachers are being trained and teacher training is improving, but still much more needs to be done. Overall, the perspective is optimistic. Young people are getting education. They need to get better education. They need to get it younger. But the glass is not empty. It is half full and slowly filling. Thank you very much.
Thanks, Dr. Chandramouli. That was very insightful and an eye-opener to see across the world what is the effort being done and where a coalition helps in bringing about a change. Thanks a lot for your inputs. So now then we are moving to the next segment, which is the panel discussion. It will be facilitated by Dr. Sangeeta. It's about inclusion of gender equity, CSE and PSE in colleges. So over to Dr. Sangeeta to lead this.
Thank you, Siva. Hello again. It gives me great pleasure to welcome and introduce this august panel to everyone here. I plan to have 2 rounds of questions. I will introduce the panelists one at a time as I ask them the first question. So panelists, kindly take up to 4 minutes to respond to the question. Our team will use a whiteboard to indicate when you have 1.5 minutes left, because really we want to give everyone equal opportunity here. And the audience, please think of the questions you may have as you hear each panelist answer the question, post to them and post them in the chat box. We will take up these questions after the panelists have responded. So the first question, the first speaker here, I invite Dr. Glenn. Dr. Glenn is the Chancellor of Martin Luther Christian University, Shillong, India. He's a graduate of Christian Medical College, Vellore, and he completed his residency in pediatrics at the Loma Linda University Medical Center, US, and served in the Manipal group of institutions for 18 years. An academician, he has published numerous research papers and has received several awards and titles like the Times of India Fellow and Senior Fellow at the Center for Policy Research, New Delhi. In 2006, he returned to Shillong, his hometown, and to his Khasi tribal roots as the founder, Vice Chancellor of Martin Luther Christian University, the first private university in the state of Meghalaya. Dr. Glenn, you had implemented life skills and sexuality education at MLCU way back in 2007, a year after the university was founded. You had invited Dr. Shoaiba Saldana and myself to Shillong to deliver this program. What had prompted you to do this?
Good afternoon, Sangeeta, and good afternoon, everyone. Really happy to be part of this important meeting. But Sangeeta is taking us back in history. In 2006, 2007, I happened to meet Sangeeta and Shaibia through my wife, who had met them earlier. And the first time that we talked, I was so impressed and so intrigued by, by this work, which to me had never been a big topic. And so it was a rapid learning experience for me. And when we started the university, I realized that this would be an important priority. So going back to Meghalaya, I soon found out about certain health indices. Meghalaya at that time had the highest fertility rate in the country, the lowest use of contraception, the largest proportion of children aged 0 to 6 in the country, a lot of teenage pregnancies. So as soon as we had these discussions with Enfold, it became very clear that this was something that we really needed. Apart from this, there were a couple of anecdotes that also happened. In the first year, one of our girl students got pregnant, and she was doing her BSc in optometry. And we were really worried that this would derail her education. But the teachers all rallied around and she had the baby. The father was not in the picture. She came back and she completed her bachelor's. But this was a story that made a great impression on us. Another time I got a call in the middle of the night, apparently from one of our students. This was a guy. And he said, "Sir, I think my girlfriend is pregnant. What shall I do?" He didn't tell me his name. I don't know which course that he was from. I just guessed that he was one of our students. So I said, well, the first thing that we need to do is make sure that she is pregnant. So I told him about getting a pregnancy kit. And apparently that's what they did the next day, because next day around midday, I got another call from him, the same number, unknown number. And he said, "Sir, the test was negative." So the problem was solved for the short term, but this, really brought home to us the importance of sexuality education. And so this has been our journey, and we have taken right from the first year of our existence compulsory 1 week or 2 weeks courses for our undergraduate students. A couple of years later, the postgraduate students said, we also need this. And so we started these courses for the postgraduate students. And Sangeeta, our faculty and students in the first 3 years. And after that, some of our teachers like Jenny and Ardo, who spoke earlier, they became trainers. So this was our journey that we found to be not only very important and very urgent, okay, but something that has greatly benefited our students. But more than that, it's created a lot of awareness among our faculty and among our immediate community of stakeholders. So that really is what prompted us to begin this. And I would say that perhaps if I had not met Enfold, we might have started on this journey much later, and we would have lost some precious years of time. So probably later in the program, I'll get to say more about what we actually have done. But in the first instance, I'd just like to say, this is how we began, and to say a big thank you to Enfold.
Thank you, Dr. Glenn. Next, we have Dr. Tony Sam George. He's the Dean, School of Social Sciences at Christ University, Bangalore. He's a professor of psychology with a demonstrated history of working in the education management industry. His skills include e-learning, social services, group therapy, student counseling.
Topic art workshop. Okay, and this art workshop is for whom?
He has a master's in social work, an MPhil, and a PhD, focused in group psychotherapy from National Institute of Mental Health and Neurosciences, Bangalore. He taught at the Sampurna Mountford College, Bangalore, before joining Christ University. Dr. Tony, I would like to ask you, and again, down the memory lane, you had arranged a 3-day workshop on sexuality for your psychology students at Sampurna Mountford College in 2006-2007. What had prompted you to do this?
Thank you, Dr. Sangeeta, for that question. And thank you for this opportunity to go down memory lane many years ago. I was predominantly supporting and anchoring a master's level training program in counseling psychology and in clinical psychology. And prior to working at Montfort College, I worked for 3 years at the Child and Adolescent Psychiatric Services at NIMHANS, where we came face to face with issues related to child sexual abuse and trauma among families and among young children. I noticed that there are several gaps in the training of psychologists and practitioners in India, especially in the area of sexuality, child sexual abuse, and trauma. And I think some of these gaps are because trainees in the postgraduate education of these programs do not find sexuality personally relevant to them. And that leads to several blind spots in the way they practice the discipline of psychology itself. Although students of counseling and clinical psychology are trained to ask questions about child sexual abuse and sexuality in working with clients, the fact that they are perhaps not personally aware of their own sexualities and the dynamics that their sexuality plays in their lives its relationship with their own gender identity and culture makes a big difference in the way we practice. Moreover, in the community where we were training our students, a small college, which was very, inward looking in terms of programs, just 1 or 2 programs, boundaries are not very clear. Students themselves found challenges in the expression of their own sexuality and maintaining personal boundaries and so on. So I felt that a training program in sexuality, which is experiential, which enables them to reflect on their own, life histories, and how that, plays a role in the clinical work that they do is important. I also figured that the dilemmas that many of them face in the clinical space is directly, a result of the interplay of their own sexuality, their past histories, and so on. And so to have a program like what you did, a 3-day workshop, which is experiential, which forces us to look at our own life histories, our own ideas and thoughts about sexuality, belief systems, and challenge some of that. And even perhaps for some of the students, the first opportunity to visit their own histories of child sexual abuse. And so I think those were some of the reasons why I felt that we need to provide this workshop, even though the students that we were training were students in psychology.
Thank you so much, Dr. Tony. Next, we have Professor Philip Chev. He is at the University of Geneva, the founding director of its Center for Children's Rights Studies, and a member of the UN Committee on the Rights of the Child. He's a clinical and forensic psychologist trained in Switzerland and the US. He's a practicing clinical and licensed psychotherapist and forensic psychologist, and also a court-appointed expert witness. Beyond the traditional teach, research, publish, or perish mission, his vision of academic life is to branch out in the community at large as a science practitioner and educator. So, Professor Philip, my question is, as a practicing clinical psychotherapist and forensic psychologist, would you advocate for sexuality education from early childhood years? And if yes, why? If no, why? The context is that in India, we have seen a number of very early, even primary school children threatening their peers with sexual violence. And sometimes parents are also perpetuating such violence on their children. So, Professor.
Thank you very much, and congratulations on the excellent intervention so far that I listened to very carefully. So the answer to your question is resoundingly yes. I'm going to stay a little bit theoretical and not delve into clinical cases as to why, in my opinion, there are maybe 2 angles that must be taken into account. The first is a lofty human rights, pro-social, happy community angle. And the second angle could be described as a more common sense, in the trenches approach. So rapidly, the first angle recognizes that the reality that sexuality is a central and natural element of human existence at all stages of life, even for very young children. And these are all building blocks that lead to gender identity, sexual orientation, eroticism, pleasure, intimacy, reproduction. And as such, it should be demystified for all in an age-appropriate fashion. Sexuality is also expressed, if you will, and experienced at all ages in thoughts, in fantasies, in desires, in beliefs, in attitudes, values, relations, and many more dimensions that are at the core of our human identity. Why not address it early on? The harmonious development of a child requires that recognition of these facts. And it makes sense to provide benevolent and informed guidance both from parents and from formal sexuality education. And the goal is simply to promote the overall well-being of children and to reduce, going forward in their development, to the maximum level possible, the negative, toxic, and harmful aspects of sexuality that you've alluded to and that permeate, to some extent, all societies. And here we can address the second angle, and I think what is just really important to keep in mind is that we often see children as vulnerable and therefore should not be provided information, support, and education on sexual education. And I think this is a big mistake, basically. We know that this type of education, even with very young children, provides layers of protections for later on, and probably reduces many of the dangers and behaviors that you alluded to. They develop the capacity to understand intimacy in a healthy way. Their self-esteem is boosted. So again, we should keep in mind that these programs really have a pro-social effect if you start early with an age-appropriate, evidence-based, and as much as possible, a consensual approach that includes parents. And so I'll just end here, and I think children benefit from all of this. Thank you.
Oh, sorry. Thank you so much, Professor Jeff. And next we have Amit Rai. Please unmute yourself, Amit, while I introduce you. Amit Rai did his master's in dramatics from Center for Performing Arts, Pune University, and was prolifically active in theatre for 14 years, when he acted, directed, and wrote many plays. His one-act and plays won him many awards for Best Actor, Best Director, and Set Designer. Next, Amit Rai delved into the world of cinema. He has been an associate director for internationally acclaimed Marathi film Tingaya. Road to Sangam, his directorial debut, for which he is also the story writer, the screenplay, and the dialogue writer, achieved international acclaim and won many national and international awards. We are all in awe of the finesse he has demonstrated in directing Oh My God 2. This film has garnered widespread acclaim from a diverse audience for its culturally sensitive and pertinent approach to addressing issues in the context of sexuality education. This is a mainstream film, so kudos to you, Amit. I want to ask you, what prompted you to make Oh My God 2?
Namaste, thank you for having me in this session, and I'm listening to all other intellectual panelists. I'm glad that I'm here. I didn't thought of this, that it's going to be like something which is an eye-opener for me as well. I don't know where do I stand in this panel discussion, but as a filmmaker, I would put my point forward. Well, there was an incident which happened at my place. The elder son, he hacked my email account and he opened my account. And I was scared at this incident because I was happy as well, because I never provided him the password and still he did that. So I asked my wife that what would happen if we are away and they can open a YouTube account and watch all other porn stuff and other stuff which is not appropriate at this point of his age. So I was scared. That must have prompted me that what would eventually happen to a father if son is caught in a school doing I would not say an inappropriate act or something like that, that he's watching porn or he's been in any other sexual activity or misbehave with other female or somebody. So I thought that if the taboo subject like masturbation, that if he's been caught in a bathroom masturbating, and what would eventually the school, which is the unit of society, how would they react to that particular incident? I narrated this to too many people, and then everybody, the answer was very common that no, the school is not responsible, the boy is responsible. So that was a very shocking answer. And every walk of life, those who were the colleagues and those who used to work with me, those who were assistant and few fellow directors. And I don't remember any one of them who, what I would say, encouraged me to go further with this subject. So I thought that I generally have this tendency to do whatever people stop me to do. I generally do that. So I thought that let's go and write this script, and it is going to be an eye opener to all those people, those who still there is a deep rooted what you can say orthodox mentality and discomfort among the society that they don't want to talk about this subject. So I thought that let's make this film. And now at this point of time, I think that I did the right thing, and I went ahead with the film. And now I'm sitting here, I'm taking myself as fortunate and very glad and very happy that you guys are discussing with the help of the film. So that's it. The small incident which led to the, it's very personal. That's why जब तक अपने पर नहीं बीतती है तो आदमी कुछ करता भी नहीं.
Yes, thank you so much, Amit. And you said until it happens to you, we don't think about others and we don't think about doing something about it. So now we have Judy. Please unmute yourself while I introduce you. And Judy, I met in Manila a little while ago. She is the founder and executive director of Project Women and Girls Development, a not-for-profit social enterprise in Brunei, Darussalam. She's committed to, or the organization is committed to raising awareness and promoting and safeguarding the rights of women and girls, as well as understanding their responsibilities. It helps women access and leverage existing resources to educate, engage, and empower themselves in their development and transformational journey. Ms. Noor Judy is also an independent research consultant for Southeast Asia and European Union on safe and fair migration, legal aid, sexual violence, and has presented papers in several countries like Australia, South Korea, Japan, India, China, and many others. She received the Fulbright Visiting Scholar Award at Harvard University in 2023 and is currently also a fellow associate at the Asia Center of Harvard University at the US. Judy, my question is, you take your work on personal safety to a very conservative community setting. What prompted you to do this, start this work?
Thank you so much, Dr. Sanjita, and good afternoon to everyone. Good morning and good evening, wherever you are in the world. Thank you for giving me this opportunity. And it was really great to meet you back in Manila, and we got connected. So I'm so proud to be a part of this conference that you have. So again, may I repeat that the Project Women Brunei, actually our name is Project Women and Girls Development, but I come from Brunei Darussalam. I represent now Brunei Darussalam. So we call ourselves actually just a shortcut as Project Women Brunei for easy recall. It's not for-profit organization where we help raise awareness on promoting and protecting the rights and responsibilities of women and girls in their development journey, and as well safeguarding themselves from all forms of discrimination and violence. So what we normally do is really educate, engage, and empower women and girls through our various activities. So specifically, we focus on raising awareness on the various conventions that Brunei is a signatory of, such as the CEDAW, or the Convention on the Elimination of All Forms of Discrimination Against Women. We also do the CRC, which is Convention on the Rights of the Child, and also the Convention on the Rights of Persons with Disabilities. So what prompted us to do this is that there are not many organizations in our country here in Brunei Darussalam that conducts awareness raising activities on promoting the rights of women and girls. And there are many groups working on providing various services to victims and survivors of violence. And we have a very good social welfare system. We have counseling services that are accessible. We have access to free healthcare in our country, and we are made aware of statistics of victims of violence. So, however, prevention is better in helping women and girls not to fall victims and become survivors and endure lifelong trauma. So this prompted us to really embark on a nationwide community engagement through dialogues and roundtable discussions with various stakeholders, specifically the minority groups, such as the indigenous women and girls, and they're very vulnerable in our country. We also do this with migrant women and girls, as we have plenty of migrant workers, being a receiving country of migrant labor, and also women and girls with disabilities. And we conduct programs on safeguarding women and girls and children in general from sexual violence. So basically, these are the key reasons why we are doing this. Thank you. Yeah.
Thank you so much, Judy, for that very comprehensive view of your work. I now request Finda Kashir, the student from Martin Luther Christian University, to unmute herself, which she's already done. Just like young people, so much on the ball. When would you, I know you received this education during this program, and you may have received it earlier as well. But when would you have liked to receive sexuality education as such in your life, and why?
Well, thank you for the question. And the question that you have given me, it's a very eye-opening question, because I feel that this education, I should have been given, or I should have been taught when I was during, how do I say it, during the onset of my puberty, so that I'll have more information of, you know, what a girl, what a boy has to go through in their lives. For example, when we talk about girls getting their first periods, we were uneducated regarding that. And once we get it, we kind of, we're shocked and we get scared because we don't know what is happening to our body, and it really scares us. And also because this is the age where we don't really understand what's going through with us. So yeah, I would end, the question with saying that I wish I could get this education when I was still in my teenage years.
Dr. Sangeeta, you're on mute.
Yeah, I'll unmute myself. There's a lot of background noise, drilling is going on, so I keep muting myself. Yeah. Yes, so let's go back to Dr. Glenn. And Dr. Glenn, did you face any flack for your initiative? How did you continue and expand the scope of this education? And have you made any headway with the government in this regard?
Right. First of all, it's so nice to have heard all of the other panelists now. And Sangeeta, it's so nice that you brought together such a wonderful and diverse group of people. I think I took 1 minute less on the first question, so I'll claim that 1 minute now. But I just wanted to say that our 17 years of this journey is a case study in success. And I would like to describe it in a way that would encourage others who may be starting on this journey. We had these workshops to begin with, but we've gone much beyond that. Our board has been very supportive. Our board has given us funding and staffing for a Center for Gender. We've come out with our own textbook of Northeast case studies in sexuality, which we use for all of our students. This course is taken for all undergraduate and postgraduate students. We've done research projects at the PhD level. Some of these projects have been funded by external agencies like the ICMR. Our university board also approved a position statement of the university on gender and LGBT. And this position statement drives the philosophy and drives the programs of the university. We think that we have had a good influence in our community, with the government, within the education sphere. We are a Christian majority state, and I think that we have made a good influence also within the church. Having said that, you use the word flack or opposition. This has not been completely smooth sailing, because there are many conservative elements, among our Christian communities that are against the idea of sex education, against the idea of accepting that homosexuality, can be normal. So one of our great challenges has been dealing with church leaders and with church groups, though I must say that many of the church leaders have come around very well, and we are facing less opposition than before. Actually, we also were influential in the state mental health policy, which came out in March of this year, in which we were able to get a section on gender and sexuality. We have worked with getting central government grants. We have worked with the district commissioner's office in several of the districts. We have also got community support from the traditional panchayats or the village dorbars. So actually, we have had a long journey, and we've spread our influence quite far and wide. What are we thinking of in terms of the future? One of the recent projects is to start making a glossary of terms of body parts and reproductive functions, because these terms don't exist in the tribal languages in the Northeast. So we began this exercise with a group of linguists and with a group of community and social workers. We think this will be very helpful. We also want to do some long-term studies, having given these sexuality education workshops to our students. Maybe 10 years down the line, we'll have to ask them, did this really change your behavior? We also want to look at our state. Has the fertility rate come down? Has contraceptive use, has it increased? So our journey is not complete. I think that we are perhaps maybe halfway where we want to reach, and a lot more work is to be done. But we hope that in the next 5 years or so, the second phase will really lead to better indices for youth awareness, for maternal health. And this is what we hope to accomplish in our state.
Thank you so much, Dr. Glenn. That's amazing, the kind of work and how you're expanding its scope. Dr. Tony, I would like to ask you, did you face any resistance or opposition for your initiative at Christ University when Enfold ran a diploma covering sexuality education, and also when we partnered with the School of Education to train your teachers of Bachelor of Education in sexuality, diversity, and all of that? If you did, how did you overcome it? And if you didn't, did you do anything to preempt any opposition?
I think a big chunk of barrier came from the administrative structures within which we work in higher education, in terms of offering additional diploma programs over and above the programs that students are already pursuing in a university, and having to go through several statutory bodies to kind of approve some of these programs. And if I recall, I had to take some risks in going ahead with these programs, because I believe very strongly that these are important programs for training our students. If you recall rightly, we started the postgraduate diploma in life skills and reproductive health. We positioned it like that so that we can counter the stigma that is associated with certain terms in universities like ours. And we had students who were already pursuing their master's degree in counseling, and a few students who had signed up for the program from outside the university. There were barriers in terms of the difference in the teaching methodology. The pedagogical approach, the andragogic approach was different. It was highly experiential, internship specific. Students had to go to schools and do training programs there and come back and report back. The assessments were different. So these were definitely challenges that I recall that we had to face and work through when it came to implementing the postgraduate diploma in reproductive health. But today, as an outcome of some of those early experiences, we have master students now regularly going to our network schools, Christ schools, and providing training in sexuality for the 7th, 8th, 9th, and 10th standard students, and also in the Christ Special School with children with developmental disabilities. In terms of barriers with implementing the program at School of Education, not much. We had a fairly flexible program there. one of the biggest challenges, I think, is to get faculty investment, because faculty are already invested in a lot of work, and for them to provide their expertise and time is challenging. So I think those are some of the barriers that in a university like ours we had to overcome in implementing these educational and academic programs in sexuality and reproductive health.
Thank you so much, Dr. Tony. I would now request Dr. Philip to tell us what he feels, what the UN Committee on the Rights of the Child specifically can do to further this work. In what ways can the UN support organizations to further their work in this area?
Well, thank you very much. So the UN Committee on the Rights of the Child, as you can well imagine, does not work in a vacuum, and it's part of a human rights system that at its core is designed to try to make governments respect human rights, call them out for their violations, recognize victims of human rights violations, and seek justice and redress. So to start with the Committee on the Rights of the Child, our perspective is that sexual education is a right that supports a whole range of overlapping rights of children: the right to education, health and well-being, protection from abuse, exploitation, identity, non-discrimination, freedom of thought, conscience, and religion. So we've, and all the treaty bodies, CEDAW and CRPD in one form or another have said that sexual education is a right, and that it's a positive obligation of states to fulfill their human right commitment on this right. We've written in one of our general comments that children have a right to, quote, age-appropriate, comprehensive, and inclusive sexual and reproductive health education based on scientific evidence and human rights. Let me also mention that the Special Rapporteur on Education has been really stark in her way of putting it. Sexual education is a matter of life and death, and it's true for many boys and girls, mostly girls around the world. So it's also a constant pushback for us against the attitudes in many parts of the world that sexual education should not be provided, with this idea that one should protect childhood innocence. And it's really curious to me that some circles, often rather conservative and religious, equate childhood innocence with non-sexuality and sexual ignorance. And I think it's just, it makes no sense. It's just the opposite. They are protected when they know more about, have more information. The UN at large, many of the agencies, UN Women, WHO, UNICEF, UNESCO have all been working very hard. So when we review each state one after the other, and we've come down pretty hard on some states with regard to sexual education. I'll give you some examples from 2023. For Mauritius, which we called out the state for, quote, insufficient provision of sexual education in schools. This is part of a binding recommendation. For New Zealand this year, we asked that they provide the training of educators on the sexuality in accordance with its education guidelines. And with Ireland, we were even a bit confrontational with them, with the government, wondering why children and families were complaining so strongly that the church still controlled directly and indirectly most of the sexual education, while not being in line with international standards. So I look forward to when India is going to be reviewed. I'm not quite sure when. I hear it could be in the next couple of years, but for sure that's something that we will bring up, and we will make a very strong recommendation. I'm absolutely certain on this with regard to sexual education. I want to end with one more thought, and because I was thinking about this panel and I like to be a bit provocative. We're so much behind what children think around the world on this issue. It is embarrassing, whether it's my committee, myself as an adult, as a male. And, you know, around the world right now, children are expressing things in ways that were unfathomable to me. Think about gender fluidity and how this is really on the radar everywhere. And it makes many, many people so uncomfortable. So my sense, and this is my provocative thought as a conclusion, is that children and young people are telling us in many different ways that they are way beyond sexual education and what it provides. And the overall attitude of adults towards children and youth is woefully antiquated and inadequate. So I'll end with this. Thank you.
Thank you so much, Professor Philip, for that. Yes, totally agree. We had fifth graders writing the question and asking us, how do lesbian and gays have sex? Right. So yes, and next question is to Judy, and it is about how did you preempt and overcome potential or actual challenges from a conservative community? What approaches do you use in your fieldwork to overcome this?
Thank you so much for the question, Dr. Sanjita. So basically, building trust and respect among the elders of each community help preempt and overcome potential or actual challenges from a very conservative community like Brunei Darussalam. And we have the village head that leads the village council. We have the women's bureau in each of these council. And these are the small unit of the society that we targeted in terms of explaining to them our objectives, as well as walk them through the process of our engagement. So this doesn't happen in one meeting. We have a series of meetings leading to the actual event. And a lot of preparations are done from conceptualization, making the activities tailor-fit to the needs of the community, and ensuring that we are sensitive to the culture and tradition of the community. The preparatory stage is crucial in ensuring the success of each engagement. So normally it will take around 2 to 3 months before we are able to conduct the actual program in a specific community. So our strategy engagement became intergenerational since the elders, the parents, the youth, and the children live in one longhouse. As an example, so in a longhouse, which is the usual dwelling of most indigenous community here in Brunei, there are about 150 people who live inside. So you cannot just come in there and do a lecture. They will not listen to you. So how do you engage and get the attention of the people in the longhouse? So what we did is to show a short film on sexual abuse, which is in animation form. This catches the attention of the children, the youth, and the women, and even the elders. And this became a focal point for discussion. So after the film showing, we have our own volunteers who are facilitators. We group them according to age, and they have their own process of questions which revolve around this question. So for example, the first question was, what do you see differently in the film? And what else do you see? So some children may not be able to answer that, but others are able to do so. So we try to restructure the sentence. And then the second one is a follow-up wherein, how do you feel about the story and the characters in the story? So this is something interesting wherein they identify themselves in the story. And then after that is an action planning, like what can I do to prevent this from happening to me? And then the last is a group work wherein what should we do as a community to prevent this from happening to our members in our own indigenous community. So this is quite a very interesting set of questions that really works best, when we do the engagement with the community. And then here, children became aware of the topic on sensitive issues like sexual grooming and incest and sexual harassment, even sexual violence. And these are very sensitive topics for parents to discuss with their own children. So at least our program became a conversation piece in the community, and the sense of responsibility and accountability is raised among the elders and the parents as well. And children suggested various ways on how to safeguard themselves. We had also some sessions on the good touch and bad touch, and their circle of trust whom they can report if something happened to them. And we tell them the helplines they can call for emergency. So we have here in Brunei helplines for children, for welfare matters, for mental health issues, and of course the helpline for the police and ambulance. So we make sure that the children and the whole community knows about that. So we also have expanded our programs to migrant women and girls, as well as with women and girls with disabilities. And they're quite vulnerable. And we also have at the moment the Women and Girls Legal Advice Clinic, where we encourage volunteer lawyers to help us with our clients to know their rights in both civil and Sharia law, because 64% of our population is Muslim Malay. And with the advice given to them, they can make an informed decision on their legal issues. So far, this is the interventions that we have done, which has proved to be very successful. Thank you.
Thank you so much, Judy. My next question is to Amit Rai. And the question is, what can the media, and here especially we're talking about movies and serials and such, what can they do to further the cause of comprehensive sexuality and personal safety education? In your views, Amit, what can be done?
Thank you, Dr. Sangeeta. I don't think that we are at a very nascent stage of this. If you want, the problem with our media is that they are the part of the society, and they behave in the same fashion. So and most of the exactly, I can't pinpoint the exact problem where it is coming from. Now again, I go back to the same statement which I made earlier, that there is a deep-rooted discomfort and a thought running behind it. So the media, which itself is the part of the society, if they have to conduct a program or a movement which can educate the children, and which hasn't been done yet. So now that's why I'm telling that we are a very nascent stage. As a society, we are developing nation, and we are developing our thoughts as well, as for that what you can say, the media and the advertisement or the TV is concerned, or the films are concerned. Now the problem is, if I have faced so many problems to make a film which almost took 5 years and almost rejected by 9 to 10 big production houses, which they thought that it's a gross film, it's a porn film, it's a semi-porn film. So how I would take the help of the same media to propagate my thoughts or my opinion or my views to further enhance the, or what you can say, strengthen this cause. Now, moreover, the censorship, I would like to raise the point on censorship. The censorship board, the censor board, who is responsible to take this further to an audience, and if they have given a certificate to a film which is made for teenagers, the whole purpose defeated. Whole purpose is defeated for the making behind the film. So now all went in vain, that you have made a film, the first adult film meant for kids, but it's an A-rated film. Nobody can see it. Now the problem is that how I'm going to convince the same media that we want to take this further with the help of you guys. Of course, it has a very major and very important role to play to educate the kids. And as Philip sir has said earlier, that we know nothing. The kids in our generation now, those who are called whiz kids, they know much more. They have much more knowledge about it through the media or the mobile or the internet which they are using. हमें कुछ नहीं पता जितना उन्हें पता है. They have a gin in their hand, they just rub it and it gives lots of information. So, and we don't know whether the information is right, appropriate, or whether it has been given in a scientific way. So now the problem is that we have to first overcome this obstacle, that how I'm going to convince the media or the press or the people, those who are running this, that we want to take this further. The second point is that we are having this very powerful instrument in our hand, which is called as mobile. Now, even though if we are not willing to teach them, they are going to get that information from the mobile. We are not going to. Now it has the floodgates are open. Everybody knows everything about it. As I said, Philip sir has said that they know much more than us. There is no need to educate now. Now how we are going to take it very natural, scientific way to take the school or ask the school to take it in curriculum to take this further.
Thank you so much. Thank you so much, Amit. I will now ask Finda to come on. And the last question to the panel is to Finda. Did you face any challenges in discussing sexuality-related points with your older family members? How did you overcome them? Or in case you didn't face any issues, what would be your advice to youngsters who may face some challenges so that you can move ahead without alienating these so-called elders in the family?
All right. So yes, I do and did face challenges, but at the same time, I do see a huge gap between our understanding. So until now, I still do not feel comfortable in telling or asking anything which is related to any sexual content or any, any factors that is that relates to sex, because the fear is still there. Because we were never allowed to ask anything which is sexual. And the most common thing that we did when we see any, let's see, a scene in a picture or a movie, what we would do is they asked us to cover our eyes, and we asked them what it was or what is it. Like, we're so confused. And they say, yeah, it's nothing. We just brush it off. So I think for me personally, I grew up to that idea that, okay, you cannot ask anything which is related to sex. But at the moment, for the second question, I would say that because of the knowledge that I have gained through attending the workshop that Enfold had, conducted last year, if I'm not mistaken, and also in the university we had a workshop on gender and sexuality. So because of those experiences, I kind of have the confidence to go to them and ask them or tell them if, sometimes they would say something which is quite conflicting. So I have the confidence to now say that, this is not right. I have attended a workshop that says this so and so. So I feel really, very grateful that I have attended the workshop and I have learned a lot. So thank you.
Thank you so much, all the panelists. And I would now open this discussion to the audience. If there are any questions here, then we can take them up. I see there was a question, which I think Amit has already answered, about why OMG2 was given an adult certificate. We have a question. I think children are mostly exposed to sexual content through digital platforms. And I've lost the chat somewhere. They are exposed to digital content. You type SE in Google and X is typed automatically. It's crucial to educate parents and adults about this issue and their role as digital guardians, as they are the resource providers for their children. Yes, certainly. Certainly. Anna Tane Varghese is asking, though drawing from Dr. Tony's sharing, this question is more on the content delivery and modality used for imparting CSE and PSE. The schools and teachers usually have their hands full with no time for anything else. In such a scenario, can't we have some way of integrating the content in already existing subjects? For example, stories in the English textbook help both learning English and sexuality education. Can't our science books have chapters carrying the science of sexuality education? This might not overburden the teachers or the school. I know it can be a big fight with the education system, but would like to know, will such a modality? Yes, and we have already done this in the Telangana state textbooks. We have, trying to get my video on, yeah. We have integrated messages in the Telangana textbooks on POXO, on self-esteem, on gender equity. There's not much we could do about sexuality. But a lot of other things we could introduce: sexual abuse, personal safety rules, no-go tell. So the integration into the school curriculum, as well as all college streams, not some gender studies which sits in one corner, but all college curricula need to have this education. And coming to schools specifically, beside, we put it in the English textbooks from grade 1 to grade 10. We are also encouraging art. In the art class, instead of drawing apples and bananas, they could be drawing what makes them feel safe, what makes them feel good about themselves, what they feel about their bodies, who do they feel safe with, what are the emotions they are struggling with. So entire life skills and sexuality education, safety education could be integrated with the art lessons, with dance and music and all of those. That I feel really is the way, and English textbooks are the way to go. The other questions, I'd like to see what they are. So I'm trying to get to the questions. Where are the questions? Yeah. I think, how do we stay mindful of cultural beliefs of a community while promoting PSC and CSE, especially when they are in contrast with it? So actually, Enfold's work has only expanded even during the time when we had the so-called ban on sexuality education in Kerala, in Karnataka. We continued with our work because we say respect all parts of your body, respect all functions of your body. So we take the beliefs in the community that are working, that are already existing, and which serve our purpose. So respect, now instead of saying respect your elders, we say respect everybody. It's a beautiful thing. Respect non-living things as well. So we expand on that. We use culturally acceptable terms. For instance, from grade 1 to 4, we don't introduce the term intersex. Even though children come and ask, what do you call a person who is half male, half female? They will ask like that. That's the idea. So we just say it's a variation in the sexes. But the term is introduced much later. Intersex actually as a term we introduce only in the high grade, from grade 8 onwards. The word transgender is introduced much earlier, from grade 5 onwards. And before that, we may answer their questions as that there is a variation in the way we think about whether we are a man or a woman or a girl or a boy. And for those different variations, we have different words. Just like for feeling happy, you have so many different words. That, and then we also bring in how we are responsible for what we do and how our actions describe us. Like if I'm bullying somebody, I'm making the choice to bully somebody rather than make friends with people. And then we go into how having more friends is more worthwhile. So that is the way to make it culturally relevant. And toning it down, if required, tone it down, but stick to the minimum, the basic, and also the scientific. So, for instance, masturbation. Many a time we are asked, is it okay to masturbate? But because my religion says it's a sin. We don't go into whether it's a sin or not, whether the religion is right or wrong. We talk about what are the effects of masturbation, whether there are any and there aren't any as such. And then we talk about how your behavior and your beliefs need to be in sync. If you believe that masturbation is a sin and then you masturbate, you will experience stress inside. So either change your belief, which can be changed by getting more information, sharing experiences, reading up, discussing, or change your behavior through self-control or whatever else. But your beliefs, deep-rooted beliefs, and your behavior need to be in sync. There's a question saying, in many schools in rural areas, teachers themselves find it shameful and feel shy about giving information. What can be done about this? Yes. So they do feel that, and I feel integrating it to the B.Ed curriculum would have teachers coming out with the vocabulary. It's just the vocabulary. They don't know what to say. That is the thing, and it can be addressed. Teacher training can happen. Also, there is a question to Pinda.
Yes, ma'am.
Now that you are empowered, what are the kinds of confrontation do you think you face going forward?
Okay, I think it was, let me have a look at the question. Girija. So thank you, Girija, for the question. The first confrontation, the first problem or the first issue that I'm going to face, because I've gained the knowledge regarding sexuality, is I come from a very conservative family, excluding my immediate family, but I come from a very conservative family. So with them knowing that I am very open to talk about anything related to sex or sexuality, I think the first question that they are going to ask me is, are you mad? Are you insane? Why would you say such a thing or so openly? So that is the first maybe first issue that I am going to face. Right now, I might not be able to face them, but I do feel that that might be the first, the first issue that I might face.
So there is a question about whether consent online safety agency is a part of the curriculum. Yes, of course, definitely it is. And we also say that it is your responsibility. What you do is your responsibility. You can't blame others for it. There is also a question on this about shame and teachers finding it shameful. I would request Pushpalata, if she's here, to share something about her experience in training government school teachers. Pushpa, are you there?
Yes, I'm here. Thank you, Sangeeta. Yeah. Actually, we have trained about 500 government teachers drawn from the rural parts of Karnataka. And I would like to really share here how they really see about sexuality and their perspectives towards sexuality and sexuality education for children. The moment I saw the circular which was sent by the education department, we were talking about the gender equity, sexuality and personal safety, where the sexuality part was missing. So I just spoke to teachers why the sexuality education part is missing in the circular. And the response that I got from the teachers were like, if there was a mention about the sexuality, none of us would have been come here, because we all think that it is something very shameful to talk about it. And this was the first response I got from the teachers on the day one. And it was amazing that on the day two, after the session, they were saying there is a lot of perspective changes among individuals, how they see sexuality. And they were also saying that they're open, they're free to talk about these things with children. Because the moment we discussed about the sexuality, it is not, the inhibition is not in the children, it is in the adults. Because they see this sexuality as a shameful talk, and it is something taboo that nobody can talk except adults. But yeah, our efforts towards training these teachers are like changing their perspectives towards sexuality and talk about sexuality with responsibility and respect. So that is what the learning that they took from the sessions, and teachers are recommending for this education even to the department that we need to have this in our curriculum. Thanks, Sangeeta.
Thank you so much, Pushpa. I would request other panelists who are here to kindly respond to the questions that have been posted. I've answered some from my perspective. I would like to hear from other panelists as well.
I would like to add to what Pratima ji has just said. We met a girl around 15 in one of the universities. I was called for deliver a lecture on this same topic, breaking the taboo. So school, mid-level school teacher, she asked this question to the kids that what exactly is good touch and bad touch. So there was this girl from the rural area. She explained the meaning of good touch, which will surprise you all guys, that what an ignorance or the lack of education can lead to. She said that much later in my life, I came to know that my maternal uncle used to touch me inappropriately, but I used to feel good about it. at that point of life, at that point of age, she used to feel good about it. She thought that exactly is the good touch. So merely just stating or giving the definition of good touch and bad touch is not going to solve the problem unless and until we are going to have a very open perspective or the broad, what you can say, approach to the whole subject. That we should be able to utter a word penis or vagina in front of a kid so that it becomes very normal. It desensitize the word, so that in the later part of their life they are not going to get ashamed of these words. Abhi aise bol rahe, shame. We generally have this tendency to what we have to discuss. We generally used to cover those. We just throw it under the carpet and just go ahead with this. So what is eventually is going to happen to the kids, because it's very, very important for these children, those who are in adolescent age, they should know the definition, the right definition or the scientific definition of each and every term, so that they can, as he said, that it's very dangerous. It's very essential for everybody to have this knowledge. As parents and teachers, they teach us how to behave, the good manners, the civic sense, everything. The education about the sexuality is that of much importance, so that it can impart it to every kid in the society, not in India, I mean to say it, in every kid in the society. Then we are going to prosper. It's not going to happen in one day, I know that, but still we are coping with this.
Yes. Thank you for that, Amit. And the last question I'm going to answer is about the app. Yes, there is a huge scope, and this study actually on our intervention reflected how TOT model leads to a lot of loss of information. So it would be great to reach to these children, to the adolescents in colleges directly through an app. And Enfold wants to develop one with the help of a lot of people here, so that it becomes an internationally acceptable, valid, relevant app. So definitely that's what we are thinking of, because they're all adults and they can access it and they can read it for themselves, and they can be still in a college setting. They could have contact sessions, they could have discussions, peer-to-peer discussions supervised by a staff or facilitated by a staff, and that could really help. So with that, we have gone a little bit over time. I hand over the mic to Shiva. Thank you.
Thank you.
Shiva?
There is some technical glitch.
Okay. So I will proceed with the next item. On this was the launch of the Global Coalition, a formal launch. So I would invite... No, I think I still have some time. Oh, what is this? I have time till 5:15.
Yes, Dr. Sangeeta, Siva here. You have the question and answer session.
Yes.
So
Sorry,
we have segued into the question and answer session. Yeah.
Are there more questions that we can take, or are there other panelists who would like to share their views?
Glenn wanted to share some more information. So can you please skip that?
Sangeeta, I just wanted to make a short comment. The issue that we are talking about today pertains to the younger generation. And when we have seen the younger generation coming forward and speaking openly, it carries much more weight. Okay? Then if some old professor like me comes and gives a lecture. So it's not only important for us to impart knowledge and skills and new attitudes and behaviors for our young people to look after themselves, okay, but also to encourage them and train them to become spokespersons. They should be in the forefront of carrying this message to their peers, and maybe people like us, could be behind the scenes, encouraging them, facilitating all of this. But I would suggest that more and more young people should be in the forefront, and they should be the spokespersons for their own age group.
Yes. In fact, Dr. Glenn and Dr. Tony are both here. This app that we want to develop for college students, we would like to develop it along with the students of your college and your faculty. So that could be a nice collaboration, and for some other universities across the globe, we could rope in. I'm just seeing if there is anybody else. Yes, Greta endorses Dr. Glenn. Okay, fine. So if there are no more comments, and this good touch, bad touch, yes, it is out of the vocabulary. Most people are using safe touch and unsafe touch. Good and bad are moral judgments, and some unsafe touch can feel good. And we also actually describe that these touching rules are not to do about how you feel. They are like traffic rules. They're just there. We don't touch each other in these private parts. We just like traffic rules. It's not like, oh, I feel like driving on the right side today. Oh, I feel like stopping at a green light today. I feel like, no, it's not about feelings. They are very specific rules about touching, talking, and also clothing, which is to do with seeing and showing. And we call them rules because our POCSO Act is actually describing each one of them and how they can be broken and what is the punishment around it. Later on in life, it goes into consent, and all this can happen with consent, which is only after 18 years of age. So we impress that on the young audience that we have, that POCSO says that no sexual consent can be given by anyone under 18 years of age. We also talk about no-go tell as a guide, personal safety guide, so that it's not a must. And if you don't go away from that space, if you don't say no to the abuser, if you don't go and tell any safe adult about it, still not your fault. You will not be punished for it. It's a guide. So no go tell guide, and the 3 safety rules help enhance our safety. They don't guarantee it. And we also make space for mutual peer-to-peer sexual exploration, socio-sexual play that happens between 3 to almost 7 years of age. So we make an exception for that and explain that. And again, we say that we can't force a child to play this game if they don't want to. So we bring in consent even at that stage. So any last comments by anybody would like to share? There's a comment by Anna Tane saying, definitely there are laws on child pornography as a punishable offense, but how about spreading pornography to an extent that it's accessible by anyone, even by a child? Any law regarding this? Yes. Showing a child pornography or using a child for pornographic purposes is an offense under Indian laws. See, it's not pornography as such that you want to spread to children, because after all, it's a sexual act which their bodies are not ready for. A 6-year-old is definitely not ready to see all this. Maybe just would wonder what's happening, what are they all doing? So I would say that they do need to learn about their bodies and the function of these bodies and how the babies come and how the baby gets inside. This can be explained using very simple words like baby house, baby birth passage, just like we have a food passage and a breathing pipe like that. It can be done, and it's there in a Bal Suraksha app. You can see a lot of these apps, the 3 apps that we have, use a QR code which is on our website, and you can download it on your Android phones. Please, yeah, Karnataka State is revising the curriculum of schools. Is there any effort to include this subject in the curriculum? We have been knocking on the doors for a very long time. We succeeded in Telangana, but not in our home state. But the efforts are still on. Pushpa and team are in discussions. I mean, this is in open. I don't know, Anna Tane, this is in open, which is, I don't understand, Anna, what your question is. So over to you. Yes, yeah, sexually explicit material, so much is online. Yes, it is. It is very explicit, and without any context or anything else, it can be very disturbing for the child, and they may try to play it out, act it out. So it's important that even when you're watching something on TV or on your screen and the children are there and it's heavily sexualized, you want to stop it. You may stop it, but do tell the child that what they're showing is something that adults do in private when they love and care for each other. When they show it like this in public, everyone can see it. It is making me feel very uncomfortable. So I'm going to switch it off. What it does is it tells children in what context this is done, privacy and all of that. But it also says that when my parent feels uncomfortable sexually about something, they talk to me about it. So I can also talk to them about something that makes them feel uncomfortable sexually. And what is sexual? It is not reproduction. It is just that your body perceives through your senses some images, some sounds, some words, some scents that arouse the sexual parts of your brain, that arouse the sexual organs. That is sexual. It's like being able to taste sweetness. We don't guilt a child for being able to taste a sweet. Why guilt them for being able to experience sexual pleasure? It's a part of their bodies. The nerves are there from birth, and they'll stay till the end of their lives. So with that, I hand over the mic to Shiva.
Thank you, Dr. Sangeeta. First of all, a great opportunity for all of us in the audience to have such a diverse panel, and we could get into their journey, hear about their journey, their efforts, their insights, and it was a real value add for us. And we really thank the panelists for their time. And the questions from the audience, they are coming, and there may be more questions, follow-ups, or unanswered questions you might have. So please email to us at info@enfoldindia.org. So we will be typing that in the chat, and you could keep the subject as query on Global Coalition, just the Global Coalition. It will be easier for us to answer the queries. So now let's move on to the next segment, which is the launch of the Global Coalition. So I invite the Programs Prevention Team, Enfold, and Pushpalata will be doing the launch. Here you go.
Thank you, Shiva. Hello, everyone. I take this moment to introduce you to an initiative that holds immense potential to drive positive change on a global scale. This global coalition to promote comprehensive sexuality and personal safety education is an effort towards addressing the urgent need for holistic and accessible sexuality and personal safety education for children. With this coalition, we intend that people will come together to promote sexuality and personal safety education in their respective regions, countries, communities, workplaces, and families. The coalition will explore what is meant by sexual, discuss the sexual development of children and adolescents, and what is normative and what may be concerning sexual behavior. We will discuss how we can talk about sexuality and personal safety with children in restorative, value-based, age-appropriate ways such that we create a safe, respectful, and enabling environment for them to share their concerns and experiences. This coalition will act as a platform that will enable voices from across the world to understand the region-specific nuances of sexuality and personal safety education, and the barriers, and also responsibility and the possibilities. Yeah. It will facilitate an exchange of ideas and best practices from across the globe and discuss cultural and region-specific myths and misconceptions and how these could be addressed. In this way, the coalition will promote the development of region and culture-specific ways of discussing sexuality and personal safety with children, adolescents, as well as adults. Studies have shown that young adults who have undergone CSE at an early age tend to delay sexual activity, make informed decisions about it, and demonstrate safer sexual practices. The coalition can also create global campaigns by leveraging the members' strengths to address these concerns and approach this education in a scientific, value-based manner. The coalition will be guided by the core members that will be elected democratically by its members. The coalition aims to meet quarterly, starting from January 10th, 2024. In conclusion, promoting comprehensive sexuality and personal safety education requires a 360-degree approach that requires all stakeholders, including adolescents, parents, teachers, counselors, social workers, health professionals, internet and content developers, online media, print media, movie directors, songwriters, advertising agencies, religious and spiritual leaders, law enforcement and policymakers, and governments to be an active part of promoting it. We encourage all present here to join the coalition and become an active part of promoting comprehensive sexuality and personal safety education. As we collectively embark on this journey, we have 92% of total registrations so far have expressed their interest to be part of this coalition. I also thank people who have given their suggestions on the white paper. We invite each and everyone here, as well as people you may know, to be part of this coalition. Your expertise, insights, and passion are invaluable. Together, we can make a difference. Stay tuned. We will share an invitation to join the upcoming discussions and events. Thank you all.
Thank you, Lata. What a set of powerful events so far to promote global coalition. So there is something which I can recollect, that one of the marvelous things is basically a community where it can enable us to help and assist people which we can't do individually. So that is where we are geared up to. So I now invite Bilkis Ganji, Director, Strategy and Approach, Enfold, to give us the closing note of this event. Bilkis, here you go.
Thank you, Shiva. As we come to a close, I'd like to express gratitude to our exceptional speakers. Over the past few hours, we've been privileged to witness insightful discussions that deepened our understanding. My thanks to each of our brilliant speakers for investing considerable effort in presentations and engaging us in such a meaningful way. We had participants today from around the world to listen to our national and international speakers, and a really lively and insightful question and answer session. We had registrations from 17 countries around the world, and 175 attended the event today. However, for our global coalition, we have 363 registrations, which is truly uplifting. To our participants, those who spoke today, those who asked interesting questions, and to those who simply listened, I extend my heartfelt thanks to each and every one of you. I thank Prachi, Aurora, and Pinky, sign language interpreters, for the commendable work to make this session accessible. I also certainly want to thank the people who made this really happen for their tireless efforts, and without whom this virtual event simply would not have been possible. Antara and Juhi from the prevention team, and Harsh Verma for managing our website and social media posts for this event. I invite each of you to turn on your cameras. Please take a moment to acknowledge yourselves for the incredible work you've done. Thank you for going above and beyond and for being true champions. Before we conclude, let's take a moment to reflect on the valuable insights we gained over the past few hours. Together, we celebrated a significant milestone, the completion of the 3-year Ford project and release of the report. Thank you, Dr. Vinalini Matrani, for pointing out the importance of intervention research. The study is available on the Enfold website. The Ford project opened several doors and presented far-reaching opportunities. It paves the way for the introduction of comprehensive sexuality education across all streams of graduate and postgraduate courses in all institutions. Thank you, Ford Foundation, for your invaluable contribution and unwavering support. Thank you, teachers and dedicated students, for generously sharing your insights on the training program. Your perspectives have added immense depth and value to the discussions. A huge thanks to Dr. Chandramouli for an absolutely fantastic, enlightening talk on global perspectives in implementing comprehensive sexuality education. Your insights have provided us with a broader understanding of this critical aspect. We deeply appreciate your
Bilkis, are you there? Hello?
Priority. And there were some challenges and pushback. Dr. Tony Sam George, Professor Christ University, emphasized that organizing the workshop on sexuality for students, but it was not without risk or challenge. Professor Philip Jaff, member of the UN Committee on the Rights of Child, expressed that he firmly advocates for sexuality education from early childhood years. He stated safety is a fundamental human right, and comprehensive sexuality education provides layers of protection. The UN Committee on the Rights of the Child plays a crucial role in making governments respect the rights of the child, and that they would make a strong statement when India comes up for review. Noor Judy emphasized that bringing personal safety education to conservative communities is essential in ensuring that everyone, regardless of their background, has access to crucial knowledge and skills. And she spoke of how they make inroads into these communities. Finda candidly shared that she would have liked sexuality education when she reached puberty, and discussing sexuality-related topics with older family members can be challenging due to generational differences. Mr. Amit Rai, we acknowledge and appreciate the significant potential that the media holds in furthering the cause of comprehensive sexuality education. Your movie, OMG2, boldly tackles the pressing need for CSE in schools, using its powerful narrative to emphasize the importance of open discussions on the subject. Mr. Amit, we applaud you for educating the public about the significance of comprehensive sexuality education in safeguarding individuals' rights and well-being, and for your reminder to academic institutions about their pivotal role in promoting and implementing comprehensive sexuality education. Thank you for challenging stigmas and myths, and for creating conversations around this topic. In addition, we've taken a monumental step towards a brighter future with the launch of the Global Coalition to Promote Sexuality and Personal Safety Education. This initiative can support the implementation of this education on a global scale and empower individuals to discuss sexuality and safety with children and adults in their personal and professional lives. Thank you to everyone who collaborated to plan, promote, and successfully orchestrate the Global Coalition with over 360 registrations, advocating for the mandate of comprehensive sexuality education in academic institutions. Let's carry this momentum forward, knowing that our collective efforts have set a new standard in education and safety. I'm excited to witness the positive ripples that will emanate from our discussions and collaborations. The upcoming event is scheduled for 10th January 2024, and we hope to see you there. Tomorrow, 6th October, marks the second day of our conference with a special focus on diversity and disability. Many of you have registered to be part of this significant event. Your presence will add immense value to our discussions, and we look forward to welcoming you in large numbers. Wishing you all continued success and inspiration in your mission to create safer, more informed, and empowered communities. I warmly thank you for participating. Take care and see you soon. Over to you, Siva.
Thank you, Bilkis. I thank every one of the participants for their precious time. And I'm sure you all resonate with my feelings that it was a very insightful event, flow of events with a lot of information. So invite you all to join us tomorrow. Dr. Sangeeta and Bilkis, we are all meeting again tomorrow. It was a great day. Antara, Juhi, Harsh, we're all the back-end team. It's been quite an effort to get these 2 days, and we have one more day to go, but this has been a very, very enriching day for me. I'm sure it is the same for every one of you. Okay, 3 cheers. Yeah. Thank you all. You all have a great evening. See you all tomorrow. Thank you.